had quite a normal life till I was 20. I was a good student and I studied economics. And then I made a radical choice. I became a nurse. I forgot my wings. But as a nurse, as a male nurse, as you hope you can see, I worked the rest of my life with a lot of women, and I saw it as something very positive. I learned a lot from it. I worked for many years in a hospital, and after that I started to work as a district nurse in the community. And this was the most beautiful part of my life, because I learned how to deal with all kinds of problems in the community. And I had colleagues in the same village I worked, and together we solved all the problems we met. There was not a big organization, it was just a team of nurses who organized the work themselves. We took care for patients who were terminally ill, patients with dementia, people who were discharged from hospital, and there was a big variety of activities. We also took care for little children. So it was, in that period, the most healthy job you can get. And we also built support systems in the community. It was a very inspiring job, and I enjoyed it very much. Till 1993, in Holland, we got a big disaster, because the politicians discussed that community care should become more professionalized. And what I meant by that was that it should be part of a bigger organization, managed by managers, and organized not focusing on solutions for people, but delivering products. For the nurses, it looked like this. Instead of helping patients, they had to think, what kind of products should I deliver? We had personal care extra, personal care special. We had nursing care extra, nursing care special. And all these nurses got disturbed by thinking, what kind of activity should I give and how should I code it, because there were a lot of codes. For patients, it was also even a bigger disaster, because for every task they got someone else. And there were sometimes people with dementia who got 30 to 40 different people coming at their house in 1 month. And can you imagine that every time you have to tell again what the situation is and how you want to live your life? So both nurses and patients were very, very dissatisfied about how things were going. At the same time, it looked more and more like factories, the care organizations, and I see it in a lot of countries happening. So you saw that all the things that were developed in industries and companies, they were also in the organizations, and you saw that more and more managers were taking over the profession. So what you saw was that there was more and more management layers in the organizations, a CEO, directors, managers, and they almost forgot that there were also employees. And it can be done so much differently, as you can see on the other side of the slide. The consequences, they were very different than the politicians expected, because they expected that by organizing it this way, the costs would go down and the quality would go up. They also had market incentives. But what you saw is that the opposite happened. The quality went down dramatically because of the many people who were involved with every patient, and the costs doubled in 10 years. So the assumption of the politicians was quite wrong. But what you saw was that the people who paid us were even more focusing on efficiency. So, for example, when a nurse took 10 minutes longer for traveling to a patient, she had to explain it to her manager why she did that. In 2006, some friends and myself, we thought it's time for a change. I had been director for a few years in a few organizations, and I saw that it could be done very differently. And our idea was to change the healthcare in Holland and to start a movement to show that elderly care could be done much better, based on trust and based on self-organization. So the principles I worked myself with in the 80s, we took them again as the basic principles for our organization. And for 4 nurses in 2007, we grew to 9,000 nurses in 2015. And it just happened by itself. The first year in 2007, it was some kind of experiment. So we started in 10 locations. And every time happens the same. We got nurses who just developed their networks in the community. They started to work again on the same principles we did in the 80s. And within a few months, they got their patients and they covered their costs. So there was no financial problem. So from 2008, we got 10, 20 teams a month. And every time it happened the same. They called me to come to one of the houses of the nurses. And we sat all evening talking about our profession. What does it mean to help people? And how can we do it just the way we want it? And not be bothered by any kind of regulations. So that's what we did, and the evening of the day after, I usually got a phone call from one of the nurses, and they said, when can we start? And then we started just a new team in a new neighborhood, focusing on patients as we are used to. So this went in a very high speed, and we didn't have problems to manage this because they were managing themselves. We had a small back office, and we still have a small back office with 30 people. My wife and me, we are some kind of a management team, but we don't have meetings. And everything is going very well. And my wife is always awake very early, around 6 o'clock, and then she tells me what to do, like any other wife, I think, is telling her husband. So that's the way we are managing. And this way, we have a lot of time just to solve problems. So a lot in my job I had before, I had meetings from morning till evening, and I didn't have time to solve the problems. So that's quite different. In 2015, we see that there is still no management, because there was a lot of criticism when we started. They said, yes, you can do this easily when you're with just a few persons. And then they said, oh, wait, perhaps next year they will collapse or they will have big financial problems. But the opposite happened, because what you saw that the teams were more and more in control and thought a lot of solutions they could find for their problems they met. So it was growing, the knowledge was growing in the teams, and it became more and more sustainable. We still try to avoid any kind of bureaucracy. We build an IT system which prevent all the bureaucracy to take over the work of the nurses. So all the bureaucracy was kept outside. We split the administrative process with the professional process. So the nurses just can focus on what they're there for, and that's taking care for patients. Find solutions for patients who have severe problems. In 2015, we can look at it, if we look back now, we can say we have, since we started, the highest client satisfaction in Holland. And what was very important for the policymakers is that instead it took more costs or more hours, because we're working with higher educated nurses, the costs went down with 40%. So last evening, the parliament in Holland was debating about a district nurse. And they were debating about the position of the district nurse in the future in Holland. And they said, this movement should be spread all over Holland, so we want to support it. All the political parties agreed on that. And at the same time, we became the best employer of the year, 3 times in a row, just by doing nothing. We don't have an HR department. So we don't So by doing nothing and doing less, you get far better results. So all these management ideas about controlling and command people are just, in my opinion, quite destructive. So if you just let people organize the work themselves, you get much better results, and people are much happier because they can do what they want to do. And it sounds very logic, but we make it very difficult for people to work this way in a lot of places, also in schools and also with the police. It was not only in Holland that this happens. There are a lot of countries who have the same problems. And we got questions from the United States, from Japan, Sweden, China, Czech Republic, and so on. I visited 30 countries, and every country I meet the nurses who have the same ideas, and we start the same movement, just with a few nurses. That's enough. And then you show that it can be done, and then you see that other people become curious, and they say, oh, we never expected that this was possible in our system because we have such a complex system. So we also developed a theory on that. It's the integrating simplification theory. Try to make things simple, not complex. So and when you do that consequently, it's more easy for people to take their responsibility and to think about what can be done to solve problems. So I think healthcare is about trust. I never met a nurse who didn't want to do her work as good as possible. So you can trust nurses. It's about meaningful relationships with each other, but also between nurses and patients, of course. And it is about empathy. Try to understand what the concerns of people are and try to do something positive with it. So, in my opinion, we should let's bring the soul back into the organizations and let the complexity get out of the organizations. Thank you very much.